Hello, I'm Dani, a hypnotherapist, pharmacist, and specialist in clinical research. This is Lucy, a child undergoing medical procedures who is scared, distressed, and in pain. This could be Lucy, confident, cooperative, and relaxed. How? Using clinical hypnosis for children's procedural pain and distress. Medical procedures can be painful and distressing for children, exposing them to acute and chronic biopsychosocial impairments that can negatively affect their life quality, well being, family, recovery, and subsequent pain management. In contrast, treating procedural pain and distress can prevent biopsychosocial impairments in addition to improving well being, recovery, and comfort. Thus, children undergoing painful procedures require an effective treatment for their procedural pain and distress. Despite their benefits and popularity, pain and distress medications can be limited by high costs, side effects, contraindications, inability to address pain-related emotions and cognitions, lack of tailoring, and absence of consensus on optimal doses and regimens to use in children. Thus, children undergoing painful procedures may benefit from a non-pharmacological adjunct to their medications, such as hypnosis. Hypnosis appears to be promising for children undergoing painful procedures due to safety, ability to address all pain determinants, and evidence of effectiveness for pediatric procedural pain and distress. However, reviews of hypnosis for children's procedural pain and distress have focused on pediatric oncology rather than broad pediatric context and inadequately reported interventions, pain unpleasantness outcomes, adverse events, influencing factors, barriers, and facilitators. Thus, we conducted a scoping review to map the evidence on hypnosis for children's procedural pain and distress, as well as identify research gaps and areas that require further examination. This review was conducted using the following steps: searching published databases, gray literature, and references in included studies and reviews, in addition to hand searching a key hypnosis journal. Abstract and title screening before full-text screening by 2 independent reviewers. Charting data pertaining to review questions. Summarizing and reporting findings in tables and a narrative summary based on the population, concept, and context elements. Studies were included if they include child participants under 18 years of age, are conducted in a medical context, and examine hypnosis for procedure-related pain or distress, irrespectively of publication time, language, source, or design, except for case studies, case reports, and reviews that were excluded. This Prisma flow diagram shows the study selection process. The results were published in Pain Medicine Journal. I will share with you key findings. This table summarizes the characteristics of included studies. All were peer-reviewed journal articles except for a conference abstract and 3 dissertations. 76% used controlled designs that were prospective and randomized, except for 2 controlled retrospective studies. Data collection methods were mainly quantitative, using numeric scales, FACES scales, questionnaires, and checklists. As this graph shows, most studies were conducted in Europe and America. All studies were published in English between 1975 and 2022, with 39% published since 2010. The number of child participants ranged between less than 30 in 31% of studies to more than 90 in 13%. The review included 2,205 children aged between 4 and 22 years, undergoing diverse medical procedures, including dental, oncology, orthopedic, and surgical procedures, in addition to burn stressing changes and medical examinations. Rates of refusal to participate reported in 42% of studies were between 0 and 52%. Dropouts were reported in 21% of studies and ranged between 2 and 52%. Only 3 studies reported on the safety of hypnosis, indicating the absence of adverse effects. Hypnosis as a sole treatment was significantly superior to standard care, distraction, control conditions, acupressure, audiovisual aids, play, support, and attention control based on RCTs. Hypnosis as an adjunct treatment to general anesthesia, standard care, local anesthetics, and placebo had both significant and non-significant effects on pain and distress. 61% of studies did not report factors influencing outcomes. Reported factors included intervention timing, the presence of a hypnotherapist, parents' distress-promoting behavior, as well as children's distress, nausea, pain, and rapport with the hypnotherapist. Hypnotic suggestibility had a weak to strong correlation with outcomes. The effect of age on outcomes was non-significant in 4 studies, significantly negative in 5 studies, and significantly positive in 2 studies. Barriers and facilitators to implementing hypnosis and study procedures were based on clinical observations and included children's age, coping, relation with the hypnotherapist, and fantasy involvement. Hypnosis interventions varied in their delivery mode, with most studies including live interventions delivered by a clinician or an experimenter. 29% of studies used a treatment manual, but only 10% assessed the adherence to the manual. 76% reported tailoring hypnosis to children's preferences, needs, cognitive development, and cooperation level. Hypnosis was delivered before, during, or both before and during procedures and lasted for 20 to 45 minutes. Hypnotic components were inadequately reported with missing information on inductions, suggestions, and de-inductions. The scoping review explored areas relevant to research conduct and intervention delivery that were inadequately reported and thus has important implications. It highlights methodological limitations in studies such as small sample sizes and the inadequate reporting of standard care control conditions, randomization procedures, interventions, and implementation frameworks. In addition, the review shows that there is limited evidence on the safety, pain unpleasantness outcomes, influencing factors, and barriers to implementation. However, the review suggests potential benefits for hypnosis used for children's procedural pain and distress due to evidence of superiority over control conditions and non-pharmacological interventions in 76% of studies with moderate to large effect size. Further research is required to examine the effectiveness, feasibility, acceptability, implementation, and safety of hypnosis for children's procedural pain and distress in broad pediatric context. Researchers should adequately report interventions, use treatment manuals, follow recommended research guidelines, and assess the fidelity of interventions delivery to promote replicating and comparing interventions. Thank you.